You are listening to PT on Ice, The Older Adult, a collaboration between the Senior Rehab Project and the Institute of Clinical Excellence. This is a rebroadcast of an original episode that can be found at ptonice.com.
Hello, everybody, and welcome to Wednesday's edition of PT on Ice, Older Adult Division. I am Christina Previtt, and I'm one of the two older adult faculty here with the Institute of Clinical Excellence. Today, I tend to get onto these like rants and thought processes. And over the last couple of years, I feel like we've seen the rise of the masters athlete. And being in the Jerry PT world, often we think about older adults as this highly vulnerable population. We're seeing the rise of chronic conditions, dementia, and with an aging demographic, these stats are just going to grow. But I think that it's also interesting that as much as we're seeing the rise in these chronic conditions, we're also seeing the rise of this group of individuals who is hoping to still be lifelong exercisers and lifelong athletes. And so as much as I'm seeing a lot of vulnerable individuals, I also have a 71-year-old tennis player on my caseload. I have a 73-year-old CrossFitter. I have an 84-year-old pretty competitive pickleballer. And I have an 85-year-old who's trying to get back to pretty competitive bowling. And so as I started thinking about this, when we think about masters athletics, often we started thinking about, in that 30 plus age category. But when I think about masters athletics, I'm thinking about the fact that the most records that are being broken in things like half marathons and marathon running is in the 50s, 60s, and 70 age group categories. So we're seeing this rise of individuals who are 50, 60, 70, 80, 90, 100, who are still competing in competitive sport. And so as physical therapists, I think that we need to be aware that we're going to see this divide or this spanning out of people as they get older because there's more variables at play. And as much as we need to be able to treat the person with large amounts of comorbidities, and we need to see people who, are on those clinical geriatric syndromes that are sarcopenic or have frailty, all those type of things, we also need to be able to treat on the other side of the spectrum. So people who, want to still compete in track and field at 93. ESPN just had this amazing documentary comparing this rivalry between two individuals, one that was 93 and one that was 100, who is still competing in the 100-meter dash. And so how do we do that? What do we need to consider? And as an orthopedic PT, I'm in private practice. We need to think that our masters athletes are going to have kind of two things going on. We may be seeing them for an acute injury, but we also need to consider some of the age-related processes that tend to happen over time. We know that in general, with age, we're going to see a decrease in strength after the age of 50 that accelerates at 70. We're going to see a loss of VO2 max. We're going to see a preferential loss of type 2 muscle fibers. And all of this kind of thinks that, aging is the pits. But what we know is that exercise is one of the best ways to mitigate some of those changes. And we're seeing great examples of seniors athletes who are pretty much defying these aging stereotypes. And we need to be able to serve them just as well as we can serve in a nursing home facility. And as I started thinking about this, I thought about some of these underlying arthritis type conditions that come up. So being kind of involved in geriatric PT, arthritis is something that I see every day. And if an athlete is coming in, for example, with an acute hip injury, I have to be aware that there may be underlying arthritis and that once conservative management has failed or is no longer working to the extent that gives the person the quality of life that they would like to have, that considering a joint replacement is going to be something that they are going to be thinking about. And so I started looking at return to sport considerations for hip arthritis. And I was actually surprised because there wasn't a lot of recommendations. what we were tending to see were these studies that were doing cross-sectional surveys of orthopedic surgeons who are performing these joint replacements and what their recommendations are. But when they prompted these physicians about what was leading them to make these recommendations, it was a lot of times just a thought process. And what we've seen in a lot of different niches is that conservative care tends to be our primary go-to until somebody challenges it. An example of that is after breast cancer, lymph node resection and mastectomy, the risk of lymphedema caused a recommendation for people to not lift more than 10 to 15 pounds. And we know since then that has been debunked, but that is because young women with young children were having these surgeries and then challenging that norm and saying, I am not going to avoid picking up my child for the next 10 to 15 years. That's just not going to happen. So we need to start studying this. And with the rise of the masters athlete, I think we're going to be coming in that same realm. In general, we know that prevalence of hip arthritis increases about 1.6% for every 5-year age group after 35 to 39, and that people who are involved in athletics have an increased likelihood of prevalence of radiographic changes on X-ray. What we don't know is if those radiographic changes in these athletes is corresponding to increased pain from arthritis long term, but that's a whole other podcast. And so, therefore, we need to be evaluating what these people are going to be able to do after they've had hip replacement surgeries or arthroscopies. Some of the thought processes around this paradigm is that for athletes, we are going to try and prevent that hip replacement as long as we can. In general, that's what we're trying to do anyway, but we're trying to do conservative management, and there's a recommendation for a total hip arthroscopy, or just kind of going in and cleaning up the joint before a hip replacement may be indicated, to try and preserve the natural joint for as long as possible and maintain that participation in sport. And then the recommendation is to try and go further and have the joint replacement. When they're talking about returning to sport, physician recommendations have gone into 3 groups. People who have never participated in sport or exercise, those who used to participate in sport and exercise, and those who are currently in sport and trying to return to it. And so the general recommendations is that to avoid high impact sport post total hip replacement. Low impact sports are okay, especially for people who are involved in those type of sports before they had their replacement. And for people who weren't active before, that they need to be careful about returning to any type of low impact sport and be careful with their return to play. As a PT, I'm just kind of putting out a thought process. Do we know that returning to sports that a body is conditioned to do is bad? Do we know what those impacts are going to be? And this is what I'm asking you, because this is what I'm thinking in my head. Because I know I've talked about this, identifying as an athlete, that feeling of loss may cause a soliloquy of inactivity and depression that may be hard for some of our masters athletes to come to terms with. That's one thing that I'm thinking. And then the other thing that I'm thinking about is how to best serve these clients. So if high impact sports may not be indicated, how can we help transition these athletes from potentially a high impact sport to a low impact sport? How can we make sure that they are going back to a level of function that for them makes them happy? Oftentimes our indications of successful replacement or a successful hip replacement is being able to go upstairs, being able to do those basic ADLs and IADLs, which for these masters athletes would not be okay. That is not what they think of as successful day-to-day life. And so what are we going to do for that? So I think that, I've talked about how we're working with my older clients. It's essentially the same thing as working with an athlete, but we have a more complex medical history that we're considering. So what are some of the hip strengthening movements that we can do to try and return these athletes? And I think that there is a call for for us to be evaluating some of these outcomes in masters athletes, because I'm sure that you're going to find somebody who has had a hip replacement, who has ignored physician recommendations, and has continued to participate in high impact sport. And what does that mean? When I'm looking with a masters athlete, the one thing that I want to leave you guys with is there was a cross-sectional study that looked at people who were masters athletes before going back to sport, and what was the reason why they were either continuing to participate in sport or no longer participating. And they showed that a lot of people after hip replacement who were very active before their replacement were no longer active after. And the biggest reasons for that were two. One, so for half of individuals, they pretty much stopped participating in exercise. One of the reasons was fear of damage of the artificial joint. And the second one was physician recommendation. And that whether that be because the physician recommended things that they just didn't like doing, and so they stopped doing everything altogether, I'm not really sure about what that means. But now we have individuals who have this artificial joint, but are now no longer active. And now we're going into that soliloquy of inactivity and sedentary behavior that for some of our older clients in particular can be particularly damaging. And so that's something that I want to leave you with. If we are talking about potentially doing a revision down the road because people are continuing to participate in high impact sport, but they're continuing to be active for the next 10 to 15 years, is that worse than having a person having a joint replacement and then not being active because of that fear of ruining that joint? Which one's worse? And so I would kind of think that, as long as we're not having some of these risks for obviously hip joint dislocation, some sort of infection, that we're returning to sport in a smart way, I would probably rather have, for myself, 10 more years with an artificial joint that might require a revision, but continuing to be extremely healthy and active and identify with that athletic part of me in my 60s, 70s, and 80s than having a joint replacement and then not really moving. So just something to leave you with. Tell me below in the comments, do you agree with me? Do you think that I'm completely out to lunch? Have you had any experience working with masters athletes after a hip replacement? Are they going back to high impact work? Are they changing sports completely and going into a more lower impact sport? But that's okay. Kind of give me some of your thoughts. Give me some of your ideas behind how we can better serve this group. All right. That is it for me for the podcast for today. We are starting our third cohort of the modern management of the older adult, and we can start talking about this a little bit more. The next cohort starts June 10th. So we are about a week and a half away from the next cohort. So if you are on the fence, you need to get into the game and join this cohort because it's a great conversation to have about how we can best serve our older clients. All right, have a wonderful Wednesday. I hope you guys enjoyed your Memorial Day up here in Canada. We had the May 2-4 weekend before, so enjoy your short week, and I will talk to you guys soon. Bye.
Hit me. Thank you for listening, and if you enjoyed this episode, go to ptonice.com, click on the Courses tab, and check out Modern Management of the Older Adult. This is a course that myself and Christina Previtt are going to be teaching. It's 8 weeks, an online format, interactive, and solely focused on helping students change how they practice and how they work with older adults. For more information, just go to ptonice.com. Thanks.